Hi, everybody. Welcome to our Tuesday Talks with Student Health Services. We are Facebooking live today, and we are joined with our friends from Positive Directions. Of course, I'm Heather Stafford, Associate Director and RN at Student Health Services, and I would like my friends to introduce themselves.
Sure. All right, I'm Storm. I'm the prevention intern here at PDI. My name is Brett. I'm the Executive Director here at Positive Directions.
Fantastic. Storm, you're also a WSU student. Is that okay to say?
Yes.
Yes. And so why we're talking to Positive Directions today is upcoming tomorrow is our P4 Pizza event. And it's become a pretty well-known event around campus. And basically what we're doing is free STI testing. We've collaborated with Positive Directions. This is what year are we in now, Brett?
It's been 3 or 4 now.
3 or 4 years. And you all have always done our free HIV testing for us. And now we've kind of branched out into some of the other STI testings. And so that's why we are doing P4 Pizza all together now monthly, as long as COVID cooperates with us. But people might not know about your services. So can you guys talk a little bit about Positive Directions and what that means?
Sure. Well, Positive Directions has been around almost 30 years now. We have been an HIV service organization and have done a lot of things over the years. The past few years, we've actually refocused and restructured into testing only, so prevention services. So we don't do case management and food services and a lot of stuff that would help positive individuals, but we're on the other side that says, hey, let's help you out and let's keep you safe, and also to test individuals so that one, you know, if you've got anything, we can test you, let you know what you've got, as well as link you into care. That's kind of the nuts and bolts. Our main things, obviously, we've always tested for HIV. In the last few years, we've really increased not only the numbers of testing that we've been doing, but also the type of tests we've been doing. We'll call it the old days. We'll put it back in the 90s and early 2000s. You had to wait quite a while even to be tested. And when I say quite a while, you could be up to 3 months and then several months later to get your results. Now it's just 3 weeks and you come in and see us, or as you will, those of you that are coming in to see us tomorrow, which we'll get into, you just have to wait 1 minute. So that's, technology's really gotten cool. Yeah.
That's fantastic. I remember those days. I started here 15, 16 years ago, something like that. And yeah, it was a long time, and people would leave and come back to get their results, and sometimes you'd lose them along the way. And so this is a much better process. So with Positive Directions, you all are associated with the Kansas Department of Health and Environment, correct?
That is correct. Yes.
Okay.
We aren't a government agency, which a lot of people are like, oh, so what? How do you exist? What are you? We're grant funded, and I would say our overseers is the best way to say it, is through the KDHE and Sedgwick County. So we kind of cooperate and work within all of their mandates and guidelines to do what we do.
It's a great organization. I think people are starting to recognize that logo you've had for the past few years as, you know, that, hey, that's Positive Directions, and they do free HIV testing. So let's talk a little bit about the testing and the different tests that you offer.
Sounds great.
Yeah, so Brett kind of mentioned we started out as a HIV positive individual kind of care management, and then we shifted into testing individuals and preventing individuals from contracting HIV in the first place. So obviously we do our rapid HIV test, and that's the one that you can come and get tested by us anytime. And we'll be able to tell you that same day, just a minute after we take some blood from your finger, whether or not you have HIV or not. And that is a 99.96% accuracy 3 weeks after exposure. So after that 3 week point, it's still gonna be that 99 in that 3 week range. It's just not as accurate. So we can't guarantee that the test is as accurate as that 99.96. And then we also have added a few more STIs to our kind of list over the years. So we do hepatitis C and syphilis, and those are through a blood draw. And those get sent off to the state, and they do all of our testing for those two. And then they come back to us in about 7 to 10 days. COVID has added a few days onto that. So we've been telling people 2 weeks is that end mark. And then that information will come back to you as a phone call. And so we can talk about the results in a little bit, but we are also doing the chlamydia and gonorrhea through a urine sample. And those also take about 2 weeks to come back.
Perfect. So normally when we used to do P for pizza, we only offered the gonorrhea and chlamydia urine sampling, and it would take probably a good, 5 to 7 days to come back as well. So these are all free. And I think what students need to know is that this is a community partnership. So we go through your laboratories to get results. So they're not going to get instantaneous results except for that nice HIV 1 minute result. I think it's important for students to know that because, they're used to really getting those results right away, maybe at other facilities, and there is a little bit of wait to it. But can you talk about why you implemented syphilis first and then Hep C along with the HIV?
Yeah, syphilis was kind of climbing. We were starting to see a lot more of that, and our partnership with the KDHE, as those numbers were starting to go up, they started talking to us a little bit more like, hey, would you be interested? Do you want to try this? And then one day they were like, you know what, it's epidemic. We need to put that in there. And their biggest kick there was that all testing and results and linking to care would all be free. Because here in Sedgwick County, and I'd like to look at some other numbers in some other surrounding counties, but I know in Sedgwick County, syphilis is epidemic. That word didn't mean much to a lot of people for the longest time, but here in COVID days, since we've all learned the word pandemic,
Yeah.
epidemic, is it's not all the way up there, but man, it's pretty serious. And for something that's preventable, treatable, curable, it's something that it'd be great to know right up front before it becomes too much of a danger to you. And so that, again, it's a free thing. I got to get a needle out though. That's the biggest thing. A lot of people are like, oh my gosh, you're going to get it. I'm like, nope, got to get a needle out. So, but that's been one thing we've been really working on. And as well as linking the direct link with here locally with Sedgwick County to get people, positive individuals treated for that.
Perfect. So I think probably what you've seen and what we know nationally is that with the advantageous and awesomeness of PrEP, having that medication out, and can you talk a little bit about PrEP and what that means?
Hit it.
Yeah, so PrEP,
Yeah.
PrEP is basically the pill that prevents HIV. So it basically protects your cells from getting HIV, and it stands for pre-exposure prophylaxis.
Correct.
If you have an exposure, we always recommend PEP, which is post-exposure prophylaxis, and that can be done at an ER or hospital 72 hours after exposure. So if you know for a fact that you were exposed and that individual is positive, you can go get that, and it lowers your chances of contracting the virus. It's not, of course, 0% of a chance, but it does lower it to make it where significantly less risk. And so PrEP is on the other side where if you're taking it regularly and like you should, if you have an exposure, your risk of contracting HIV from that is very low.
And what we know statistic-wise from individuals who are using PrEP is that maybe the use of condoms and other barrier methods to prevent the other STIs kind of go by the wayside. And that's probably, I might assume, but that's why we also offer the gonorrhea and chlamydia, because now we're seeing uprising in the gonorrhea and chlamydia cases because of people assuming that.
Well, and to add on to that too, several years ago when PrEP was being put out, past the FDA and everything, they were trying to get it really big. They put it out in San Francisco, and they did a whole study, and they targeted specifically gay men's clubs. And they were putting it out. There was the whole process of testing before, blood tests, all that kind of stuff and everything. And the instances of HIV disappeared. It was like, wow, this stuff works. But on the other side, things like chlamydia and gonorrhea and all the other STIs that, get passed around quite a bit, those skyrocketed. So there was clearly that whole mentality that, well, I'm taking one, so I don't need to do the other, which,
right.
that's been a big thing to try to fight too. But we have seen a change in that mentality where it's like, okay, this takes care of one thing, but not everything. So,
Yeah.
but it is a really, really interesting, amazing medicine that's out there. And the fact that there's even 2 versions of it now as well, which we would love to see more testing on the second one to see if we can, because of FDA and CDC guidelines on that second round. But the first one is quite amazing.
We will be talking about PrEP and how to get PrEP. We offer the PrEP here, the PrEP pill here at Student Health Services, and we'll be talking about that on October 20th. Storm will be joining us for that Tuesday talk as well, and we'll be talking to one of our nurse practitioners. So let's talk about P for Pizza tomorrow and what students can expect when they come for the event. Of course, during COVID, things are different. It used to be a walk-in event. We need to control the waiting room climate a little bit better during COVID and encourage social distancing as much as possible. So we did make appointments only for this event. And what will happen is you'll enter Student Health Services. You'll be asked to wash your hands with some hand sanitizer and put on a fresh surgical mask. And then you'll check in for the P for Pizza event. And one of Brett and Storm's staff will come out and get you and bring you back, and you'll sit down and talk with one of them. And why don't you guys go forward on how that looks like in the exam room?
Sure. So we'll come out and get you, take you back. Now, we are going to have a quick little sheet of paper. It's nothing fancy. It's real simple. And as always, when we say free, it's not one of those free with insurance or free with this. It's going to be free. So there'll be none of that. None of that fancy stuff there. So we'll walk you through what the test is and how it works. For HIV, obviously, we're going to poke your finger, and that result's going to happen in 1 minute. It's a pretty quick test. It's not as nerve-wracking, even though people do get nice and nervous when we do that too. But know that you're in the company of professionals that deal with this and that have been through this and have helped so many people that it's not going to be too crazy and at least not too strenuous. We'll do our very best. After that, we'll do a blood draw for syphilis, hepatitis C, nothing crazy there. And then if you want it as well, we can collect urine for chlamydia and gonorrhea. That order may be a little different depending on how we work out the logistics when we get in there, because we're super flexible types, so nothing too crazy. All questions, remember this is going to be confidential. All questions with us, ask the questions. If you want to know, you have a situation, something you're worried about, we're the ones that you need to be talking to, because we've heard it all. Well, we haven't actually. We've heard a lot. We've heard a lot. Way too much, but it's okay. We don't want you to be embarrassed, and know that it's going to be 100% confidential. We're not going to be telling mom and dad or the government or anything about it. So.
And can you talk a little bit about the results you said for the syphilis and hepatitis C come back in how long?
Up to, I have to say up to, because COVID's in the game, up to about 14 days. They can come back earlier, but the way it works, and this is one thing that is good and bad. Some people like it, some people don't, but it's no news is good news. In that if you don't get a phone call, we will not be mailing, we'll only be calling. If you don't get a phone call within, we'll just say 2 weeks, you're negative, you're good, you can move on. But if anything does come back, we'll be giving you a call, and it won't just be, hey, you've got it. It'll be, okay, this is what your lab results came back as. Here's our next steps, and here's where we're going to go to get you treated.
Perfect. And who do you usually recommend for treatment for the syphilis and the hepatitis C?
Well, if you don't have your own personal doctor, and to be honest, Heather, I don't know the full, like if Student Health treats at this point, I'd like to know those, but
not for those two.
Okay, our main one is we go to is the Sedgwick County Health Department. They've got the people, they've got, like, even for syphilis, they literally have people that's all they do is syphilis. That's their job. Hepatitis C as well. So I would say, just waiting on the call. So,
and if you want to hear if it, is the 8th day or whatever, and you just want to know, like, hey, my results are negative, or hey, we haven't got them back yet, you can give us a call and we can look up what's going on with your test. Yeah.
Perfect. So for the gonorrhea and chlamydia, we're going to kind of partner with that because we do have treatment for both of those medications. And so can you talk a little bit about how long those results take to come back?
Yeah, obviously we're sending to the same lab, but they're a lot faster because urine is way more perishable. We've seen results back in 5 days, but we like to say 5 to 7, if not maybe 10, depending on how it goes. But they're really good at getting back to us.
Yeah.
And then obviously we're going to refer students on back to you for treatment. So.
And a lot of times students like to get and see those actual results. And I know that we had talked about doing this through our patient portal, where we could send them results if we needed to through the portal, so that they have a copy of something to keep. Is there something like that that can be given to them?
Yeah, I'll tell you, we are a nonprofit, so our technology is a little bit behind on some of the things. Really at this point, because we can't mail, so we would probably just say, hey, come in, pick up something, we print it out, obviously sign all the release forms and make it so we then could give them results.
Okay, perfect. So when it comes to STIs and prevention wise, and we're going to talk about this next week, we're going to get out all the devices and play with them with my student friends and I on Facebook Live. Kind of like a name that tune, but name that device. But I think when it comes to the other part of your job, the prevention wise, is you guys give out free condoms along with your testing materials. Can you talk about some of the sexual health supplies that you offer?
Yeah, so we offer your standard condom, which everyone pretty much recognizes. That's the one that everyone knows about. When you say condom, that's what you think of.
Yeah.
And we also do internal or female condoms. And so those are worn by the female, or, they are inserted.
Yep.
And then we have dental dams, which protect for oral sex. And then we also have oral condoms, which the dental dams and the oral condoms are both flavored. So there's a ton of different scents and flavors and things that come with those. And that's pretty much what we offer.
Yeah.
Fantastic. And you guys have them in different places around campus. You have some stash of condoms over at the Office of Diversity and Inclusion for students. Mm-hmm. We also are giving out your condoms at tomorrow's P for Pizza event. I'm giving them all little goodie bags along with their pizza at the end of their testing to reward them for being brave for those blood specimens that they're giving. So those are available, but you can always come to Student Health and come to one of our P for Pizza events and get free condoms, or you can call us and ask for different supplies like that. What do you think is the most important thing you could tell students for prevention?
I would say the most important thing, prevention is communication. And that's either talking to your partner, talking, even talk online, communicate, have that ability and the knowledge. After that, we can fill in all the other pieces. So
yeah, I would say the second piece is also knowing your status. So when talking, you want to know if you have any of these communicable diseases. And so making sure that you're getting tested on a regular basis, whether that's 3 months, 6 months, whatever,
Yep.
Depending on your activity.
Yep.
Perfect. Can you give the address to your facility so that if students just want to come down there and get tested, tell them all your contact information?
I'll tell you, this is how this works, because we're in a funny little part of town that even FedEx can't seem to find us. So we're on Commerce Street. We're just south of Interest Bank Arena. Like literally, if we drive north, we're gonna cross street and run into the arena. So we're right there. Our address is 416 South Commerce. We're number 108, but here soon we're gonna be the only one here in our office setting. And obviously, the biggest thing to do is call. If you do show up and you're like, "Where are you?" There's signs on the door, but just in case, call us at 316-263-2214. Or another great place to do, which a lot of people love to do, is message us on Facebook. We're Positive Directions KS. We are really good at getting back to you because we use old school phone in the office, and these things are everywhere. That's our big way. If you ever want to come get tested by us, we are doing appointments. Call ahead, but you can drop in. We just may or may not be able to get you in right away. We'll do our best. And always, if you're needing condoms or everything, again, call us when you're here. Just say, hey, I need to pick up some condoms. We'll let you in and get some.
Now you guys do clinics, or I say clinics, but you do like pop-up, testing all over the city. Where will you be coming up?
Well, we'll be coming up immediately up. We'll be at P for Pizza tomorrow.
Right.
But I think the next one we have, we call them outreaches, and they're normally targeted. We used to do a lot where it's like, hey, we'll be here, come to us.
Okay.
We do have one next week, but that is at a specialized treatment center.
Okay.
And I'm looking over at the board. Well, some of our others have some places aren't active. So I'll tell you, right now, sadly, we're kind of slowing down again.
Yeah. Well, I think COVID has just kind of changed everybody's way of functioning. It's crazy. But I did think I saw a special event that you guys have coming up.
Yes, we have the World AIDS Day Cornhole tournament. And so we are offering a grand prize of $1,000 and branded cornhole boards. Yeah. So, and this will be mainly kind of an outreach and educational event, just getting people to have fun and talk about World AIDS Day and kind of what it's about.
Perfect. And when is that?
It is Saturday, November 21st, and it is co-hosted by Chicken and Pickle. So we will be offering it there on their little rooftop patio. It's got some nice heaters and indoor space that we can use. So even if, it's cold out, which it probably will be at November 21st, we'll make sure to have those heaters running and, have some fun playing cornhole.
That'll be fun.
How do they sign up for that?
They can sign up on our website under the events tab. We've also posted it on our Facebook with a QR code that you can scan with your iPhones and sign up. And so we played in partners. So you'll have to find a partner, and then you pay that registration fee, and then you get t-shirts, two $10 gift cards for Chicken and Pickle that day for your lunch. And then a bunch of other different coupons and goodies that we've got from different, local businesses and shops.
That's fun. We need to start pushing that out on our social media some more. If you guys know our Facebook page, WSU Student Health Services, and you can get on and like Positive Directions and all their events. They're always doing something. And it's really important to do prevention for STI. So make sure you call us so you can get lined up for P for Pizza tomorrow. But we're also continuing it the first Wednesday of every month as much as we can during COVID. You never know what'll happen. But it is from 10 to 4, the first Wednesday of every month at Student Health Services in the WSU YMCA Student Wellness Center. Tomorrow, it starts at 10. Please call 316-978-4792 for appointments. I want to thank my special guests today. Thank you. I appreciate you guys for getting on Facebook. Sometimes I have to, pull people with me just to, get on TV or whatever. But we appreciate all of our community partners, especially you guys, because this is a great advantage for the WSU students. And like I said, stay tuned for next week as we talk about different STI devices for health and making sure that prevention stays in your mind. So we will see you again next week. Thanks again. Bye.
One real quick before you say goodbye.
Oh.
One thing, this is one big thing, and it shows my age, and Heather, you're probably in the same ball game, but no, this is a generational thing, because you got students over there, and I got a student right here. What is our TikTok address?
IKS.
It's PDIKS. So find our TikTok. You'll see all sorts of fun, goofy, informational, and just really good stuff on that. So
Storm, are you doing all the TikToks?
Yep, I am. I sure am.
I'm too old for it.
My daughter said to me when I was talking about how are we going to do this with all the sexual health supplies, and she's like, I think you need to do TikToks, and I just no.
Yeah, we've had a really good turnout, so check us out on that.
Okay. Well, thanks again for joining us, everybody, and to look for Positive Directions events on Facebook. Thanks again.